get is, if I'm not pregnant, not planning on becoming pregnant, is this a problem? And I think we have learned now that really Zika is a mild illness that may cause mild symptoms in the patient being the pregnant woman or the non-pregnant person, to include rash, some fever, and arthralgias, muscle pains, and red eyes. But short of that, it's really a short-lived problem, except for the fetus. So if a pregnant woman gets Zika, we do know that it causes problems for the fetus. It appears that it causes brain damage to the fetus, and it may even go in and destroy what was previously normal brain tissue. So that's the biggest concern for the baby. And the result is microcephaly, which is a small head. We're not sure about that at this point. We know that if Zika follows other viruses that cause congenital anomalies, then it probably is most dangerous with first trimester exposure, and the earlier the exposure, the worst effect on the baby. But we do know that there are case reports of second and third trimester exposures where the baby did have brain damage as a result. So at this point, what we're thinking is that you just need to protect yourself throughout pregnancy, even if you're in the third trimester. There is some recent data from Colombia of the patients that were exposed in Colombia and those that were exposed in the third trimester. Most of them, over 90%, had delivered. And in those patients, they hadn't found any cases of microcephaly yet. So this is reassuring, but again, we don't know for sure. So the safest thing is just protect yourself throughout pregnancy. So the current recommendation is that if you and or your partner have traveled to Zika endemic areas but did not become sick or become symptomatic, you should wait 8 weeks before attempting pregnancy. If you became sick, the female became sick, it's still the recommendation is for 8 weeks for waiting. However, the male became ill with it, 6 months is the recommended time period for waiting to become pregnant. So if you're not pregnant, it's probably not important to find out whether or not you were infected with Zika virus. Again, it's self-limited disease. The symptoms are usually gone within 7 to 10 days, and there's no treatment for it other than expected management and treat the symptoms. So it really probably is not necessary for you to get that diagnosis unless you're planning on trying to become pregnant. If you are pregnant, though, it is important to get that diagnosis because of the profound effects that the Zika virus can have on the baby's brain. Well, the earlier the diagnosis, the sooner that we can start looking for evidence of fetal infection, and the earlier that evidence is found, if present, the more choices the patient has in terms of the pregnancy. Well, as far as the risk goes, at this point, it's a rather wide range of what we think is the risk to the fetus if the mom is indeed tested positive for Zika during pregnancy. It's anywhere from 1 to about 30% chance that the baby will have effects from the Zika virus. It will take some period for us to see these changes happen to the baby's brain. In our particular case that we saw here in the DC area, which was travel associated, not caught here in DC, it was approximately 7 weeks between time of infection and time that we saw something in ultrasound. So we know that you're not going to see something immediately. It's going to take probably serial imaging studies with ultrasound to find these abnormalities. So you would probably want to wait at least 4 weeks from the time of infection to look with ultrasound. At that time, you may not see abnormalities, and you would want to do another ultrasound maybe again 4 weeks later, again, because it's not going to be immediate that you see those findings. And in addition to that, the microcephaly, which was initially what we were looking for, seems to be a late finding. It seems that the microcephaly is the result of the brain destruction that occurs. So that's a late finding. So even if the size of the brain or the size of the skull is normal and doesn't meet criteria for microcephaly, you can see things within the brain that aren't normal. A question that's common is, if I get Zika and I'm not pregnant, if I do become pregnant years down the road, is my baby still at risk? Zika is only a problem to the baby if mom becomes infected at the time she is pregnant. So it doesn't cause long-term problems if she becomes pregnant later on in life. What we don't know is whether or not an infection earlier in life will then make you immune to the Zika virus. There is a recent study in monkeys that showed that if they infected the monkey with the Zika virus, within 21 days the monkey mounted an immune response. And when re-inoculated or reinfected with the virus 10 weeks after the initial infection, there was no evidence of reinfection, so the monkey was immune. So we're hoping that humans follow the same pattern, and that once you get infected, you have immunity from prior infection and you don't have to worry about it anymore. Zika is a virus, and there are antiviral medications that are out there. None have been shown to have an effect on the Zika virus until recently, the study. And what's interesting about the particular medication that they chose is a lot of the antiviral medications are associated with birth defects, so you're kind of trading off one evil for the other, so you wouldn't use it. There has recently been one that's been shown to arrest the reproduction or the replication of the Zika virus, so certainly further studies are needed, but maybe an option in the future. Effects from the Zika virus, we know again as adults that the Zika virus is a very mild illness that's gone within 7 to 10 days. So a common question I get is, I have a young child, 7 years old, that I would like to travel in the endemic area. What should I do? Because we don't know, the best thing to do is just protect that child from mosquito bites.